Hello, my name is Amani Banks, and today I will be talking about patellofemoral pain syndrome. Patellofemoral pain syndrome is a knee injury that causes pain in the front of the knee and around the patella. It's caused by improper movement of the patella, um, and it's diagnosed as runner's knee or jumper's knee. It's common in athletes, runners, heavyweight lifters, people who squat and climb stairs. Some causes and risk factors are a weak quadriceps, especially the vastus medialis oblique muscle, tight hamstrings and calves, worn out running shoes that don't distribute properly, and adolescent girls and women younger than 60 due to their wide hips, which increases the Q angle, flat feet, knocked knees, and misalignment variations, and then sudden increase in running and distance intensity with an additional overuse and repetitive stress will lead to PFPS. So how the knee normally works, the patella sits in the trochlear grove. It extends to extend the knee. Your quadricep muscles on the front side of the thigh will smoothly pull the patella up. And then to bend the knee, your biceps femoris on the back side will smoothly pull the patella down. When you turn the knee, your sartorius and popliteus muscle will work together. So the knee normally works with additionally, it has two collateral ligaments that connect the inner and outer sides of the femur and tibia, and then your two cruciate ligaments, which run from the front and back of the condyle, so the tibia both work together to give the joint stability. You also have cartilage in the knee joint, which reduces friction, and your menisci that absorbs impact from activities like running and walking. Here's a diagram. As we see right here, we have our patella. Then we have the trochlear grove that it sits in, our menisci, and then our cruciate, and then collateral ligaments. So what goes wrong? The PFPS begins to track unevenly in that grove. The patella will then be pushed out to one side of the grove when the knee is bent, and this abnormal tracking increases pressure on the trochlea, patella, and the cartilage. Additionally, when you have weak quadriceps, that adds to that poor stabilization. This will then lead to the grinding, the pain, and the swelling that limits the knee flexion. So within our healthcare management, the medical providers that can help us are orthopedic doctors, physical therapists, and sports medicine physicians, which can help diagnose and treat PFPS. It's diagnosed, so how does it get diagnosed? First, with your healthcare provider, they'll do a patient history and an assessment. They'll ask like, what are your workouts looking like? How long have you been having these symptoms for? What does the pain feel like? They'll then do a knee examination. They'll have you they'll put some touch around the knee, see if they can feel any swelling, see how you react if you show any pain when they touch it. Then they'll do movement tests. They'll see how it is when you bend your knee, when you extend your knee, when you turn your knee, and then they'll do some strength tests. Then lastly, they'll take x-rays and MRI scans. So the treatment options, majority of them are non-surgical. It's the RICE method, rest, ice, compress, and elevate. After exercising, also take NSAIDs or pain medicine. Then most likely providers will put you into physical therapy, will help you rebuild that stability. Then um, they'll tell you to do some taping and knee bracing during exercises, adding in orthotic shoe inserts, and consistently stretching those hips and quads. So surgery, if it's like really bad PFPS, they'll do debridement, which is the removal of the damaged cartilage, and then lateral release, which is the loosening of the lateral retina column to correct the patellar alignment. Symptoms and complications of PFPS. These symptoms are a dull ache in the front of the knee, which worsens within sitting, squatting, and then grinding, cracking sensation during movement, inflammation, and sharp stabbing. Complications, if this goes undiagnosed, is chronic pain, increased cartilage stress, which leads to osteoarthritis, anxiety, and losing interest in performing activities patients once loved. So, within my personal reflection, I've had a PFPS since I was 14. Because I was online so much, I started to develop like body dysmorphia. So I felt like I needed to do a lot of intense exercises in order to look the way girls looked online. And because I never warmed up properly, didn't wear the correct shoes, had bad form, This led to me having my knee starting to pop and having bad pains. So I saw a sports medicine doctor who diagnosed me with PFPS, explains that I overworked my quads. In the US, 126.6 million Americans suffer from a musculoskeletal disorder, and 22.7% of adolescent athlete females deal with PFPS. Healthcare management saved me by building my mental health, using the RICE method, getting targeted physical therapy, learning proper form and warm-ups that helped me treat my PFPS, having people having access to affordable healthcare or early screenings will prevent many people from developing chronic pain and quitting those activities they once loved. So now, because of this, I'm hyper vigilant about my form, and I learned what exercises do and don't work for my body. So, as a nursing major who has PFPS, I learned that healing isn't just physical, it's about listening to our bodies before they become a bigger issue. Thank you so much for listening to my presentation, and here are my references. Have a good one.